Thank you again for joining us today. Our speaker today is Jonathan Cottor. He is the CEO and the founder of the National Center for Pediatric Palliative Care Homes. And his presentation today is a chance to rest, scaling community-based children's respite homes. I'm going to hand over to Jonathan now. And if Jonathan, you can introduce yourselves, and you have the audience.
Fantastic, Caroline. Thank you so much for inviting me to come speak. This is my people. I am very much excited about this conversation, and very much my heart goes out to all of your families and your journeys. I know how difficult and stressful this path can be. As Caroline mentioned, our organization is the National Center for Pediatric Palliative Care Homes. That'll become a little bit more apparent as we go through the talk over the next 20-25 minutes, and then certainly want to give opportunities for conversation at the end as well. But let's kind of get into it. So just to kind of ground ourselves, I mean, you all know the family journeys that you're on, but to put this in perspective in the United States, if you think about all children in the United States, there's about 95 million kids under the age of 21 years old. If you zoom in on that group, about 1 in 5 are now recognized as having a special healthcare need. And that's really because of the prevalence of um, developmental disabilities such as autism spectrum or ADHD. And then if you keep zooming in, when you get down to chronic, complex, very significantly medically fragile children, we're really talking about less than 1% of all children. So it is a needle in a haystack kind of population, but we're all living it. So we get that. We are those needles in the haystack. And there's about 1 million of us kind of across the United States. While that population is small, it is very expensive population. So our group of families really account for about 1/3 of all U.S. healthcare spending dollars on children, and about 40% of all children hospital deaths are from that less than 1% of kids. As I said, I know this story well. My son Ryan was diagnosed with a rare disease called spinal muscular atrophy. This was about 20 years ago. And the picture on the left is a few weeks before we got the diagnosis. He was 9 months old. So we had recognized that he was not developing at the same pace that our older son, Ethan, was developing, who was about 2.5 years older than Ryan at the time. So that picture on the left looks like a very healthy, beautiful little baby boy. And we got the devastating news that he had spinal muscular atrophy. And at that time, there were no treatments, no cures. Take him home, love him, and don't expect him to live to 2 years old. So I think one of the things that your family journeys are on is that a little bit different than my personal family journey is that we were able to get an accurate diagnosis very early on. We didn't like it. It stunk. Um, and it really put us on a very different pathway around caring for a very medically fragile child, but at least we knew what it was. So that was, I think, a little bit of a difference. Ryan did end up celebrating his second birthday, then a third birthday, then a fourth birthday, then a fifth birthday. If he was still with us today, he would describe himself as moldy cheese, way past his expiration date. He had an awesome life. Uh, we had many joys during that journey, but we also had a lot of stress and strain and sleepless nights as a lot of hospital stays, back surgeries, durable medical equipment, lots of pneumonias. Ryan lived for 17 and a half years and died about a little over 6 years ago now in December of 2018. So this is a journey that I know personally as well. When you think about our kind of families, and these are points that I really make to other audiences that really don't come from our world, so to speak. And so when I'm talking to policymakers or thought leaders, and I'm trying to educate them and give them insight in terms of what the journeys like ours are, it really is about a lot of not just the physical care of the child that really does, all of a sudden we get thrust into being a very skilled nurse or a very skilled, we're caring for these children at home. And we were not expecting to be able to do this. We didn't have training or professional courses to help us figure this out. We were just thrust into this journey. And in addition to the care of the child, there really is a lot of mental health concerns, stress, and caregiving burden social isolation. A lot of our families tend to not go out a lot because of it's a lot of work to go out and go to the movies or go to dinner. Divorce rates are very high in our population, and ultimately trying to secure overnight support is really very difficult in when you're living at home. Um, so those are the kind of things that really drive me personally. And wanted to kind of get to this idea of a children's respite and palliative care home. What are those? If your community, I assume that the group that we have here today probably represents many communities across the United States, possibly even globally. Um, but when you think about not only your life and your home, but in your community, do you have a place in your community where you could entrust your child for a very short amount of time so that you could truly get a good night's sleep? Um, Something that I personally believe in, and I tend to articulate this quite often to others, is that I believe that the number one thing that a family like ours wants is a cure for their child. They will give anything to cure their child. In fact, today, my license plate still says cure SMA because today there still is not a cure for the spinal muscular atrophy disease. But I also then believe that the second thing that our families really need is a break, just a short-term break to just catch up on sleep, let us recharge, just let us kind of just debrief or just decompress for a moment so that we can get back on this very difficult um, journey and tackle that next challenge and the one after that. One of the things that I also like to say is that as you can see, I don't blur out my background when I'm doing Zooms like this. And so you can see Marvel posters and maybe you can see a Doctor Who poster in the back. And that is because I home office out of my son Ryan's bedroom. I love being in this space. This is not where Ryan died. This is where Ryan lived. And to me, he is clearly my North Star. Even today, he is why I do what I do these days. And so I'm very proud to be in Ryan's room, and I don't blur out my background anymore. Um, what I wanted to do is, I mean, I'm speaking to families that really know these journeys, but the part that's different is what are these children's respite homes? So I wanted to, I've got two videos here, but I'm not going to play the first one because that really is family's perspective in terms of why these journeys are so tough. And so this is we play a short video for people, legislators or decision makers at the Department of Health in a state or groups like that that maybe don't have the perspective that we all have. But the piece that I thought would be helpful for you all to see is the just to give you kind of a sense of what is a children's respite and palliative care home. So I thought if I could, I would play this video. Um, Caroline, tell me if this is not coming through, but this is a short video on Ryan House, which is a program here in Phoenix that my wife and I founded that is named for our son. So let me play this video and see if this works for you guys.
No sound.
Are you guys hearing it? Somebody kind of give me a thumbs up
The
or
the voice is coming through. It just needs maybe a little bit louder.
okay. I'll try and see if I can
There's a
crank
button
up.
that says share sound.
Oh, there's a button that says where?
Should be a button that says share sound.
Hmm. Huh. Well, let me
Yeah, you want to press play one more time because I did hear it.
Our family room is the heart of the home. It's a place where kids can be kids, where our volunteers and staff play games, read books, and have fun with the children. Plus, kids love watching one of our fish, Puff Daddy, swim around in our fish tank too. This is our wheelchair accessible playground where all the fun things happen. It's filled with picnic tables, an adorable train, and all kinds of outdoor activities. During the summer, we even have water balloon fights. Oh no. also the perfect place to host some of our family events, like our annual fall festival. You'll notice that all of our kids' rooms open up to the playground, and the doors are wide enough so a hospital bed can go in and out, so everyone can get some fresh air and enjoy the sunshine. Now we're in our s'mores cafe, and just like any home, the kitchen at Ryan House is the center of activity. On any given day, our kids, staff, volunteers, and families share meals here. There's always something yummy being cooked or baked, and there are a variety of snacks to choose from too, with donations from our community. Our child life specialist plans and implements life-enhancing activities that kids are able to participate in while they're here at Ryan House, along with a care team. And that care team consists of nurses, nursing assistants, a music therapist, and highly trained volunteers. We provide activities in specially designed rooms with fun and inviting names, including the Story of Me room, where children have an opportunity to create memories and tell the story of their personal journeys. We also have the Creative You Arts and Crafts room, the Do Re Mi music room, and our sensory room, which provides opportunities for children to improve communication, enhance their understanding of each other, and build trust in relationships. And of course, we've got our ever popular swimming hole. This is Lake Squeaky Clean, which always provides a fun spa-like experience for the kids. This is where our kids stay when they're visiting us at Ryan House. There's a bed to accommodate their needs, and also a day bed for a family member or a friend to stay with them while they're in the house if they'd like to. There are 8 kids' rooms in all, including 2 rooms designed especially for our team. Our wonderful nurses coordinate all the medical care our kids need. And you'll see that it's the only clinical looking space in the entire house, and that's by design. Now down this hall are 2 of our 3 family suites. You'll see that this warm, cozy, and inviting space is where families are always welcome to stay with their child. Each is a hotel-like room, including a private bathroom, which offers a quiet space for refuge and comfort, especially for our hospice families, so that their children are right across the hall and sometimes right here in the room with them. Our sanctuary is a quiet and peaceful space for time of reflection. Our families can get away from the hustle and bustle of the house and spend time with their loved ones who come to support them during their Ryan House journey. Thank you for coming along with us today. If you'd like to see the house in person.
All right, so we're back to the PowerPoint. Everybody seen that? Yes? Good. So I wanted to kind of give you a sense of what it would be like if you had one of these in your own community. This is the one that it now exists in Arizona called Ryan House. How this kind of came to be is that we are an Arizona family. My wife and I were actually living 20 years ago in London, England, though. My career was marketing, and I used to work for companies, big corporate America, brands that you know and love. I started out my career at the Dial Corporation on Dial Soap, eventually moved to Wisconsin with my wife, and I worked for Breyer's Ice Cream, then to Minneapolis, and I worked for the Pillsbury Doughboy. It was the Doughboy that sent us to London, England for a 3-year expatriate assignment. The idea was to live in London for 3 years, move back to Minneapolis, raise our family. Wouldn't life be great? But it was in London that Ryan was born and diagnosed, and then that's where our pathways really radically changed. Well, it was in London because we were 11 hours away from the closest family member, all back in Arizona, that the professional team that started to surround us and support us for Ryan's medical care had referred us to a place called Helen House. And Helen House is the world's first children's respite, palliative, and hospice home. It was started in the early 80s in Oxford, England. It happened to be 45 minutes up the road from where we were living in just north of Heathrow Airport in London. And it was described to us as a children's hospice home. So my wife and I immediately rejected that. We said, that seems to be about death and dying, and we need to find hope, and we need to really help go through this journey and really focus on Ryan. We're not ready to give up. And what we learned was that that's not what these homes are about. The professionals kept referring us to Helen House and saying, you don't understand. This is a place to help support you along these very difficult journeys. We eventually said, all right, fine, we'll go check it out. And when we did, and we walked into the beautiful home away from home, like very much like you just saw in the video, we just immediately felt at ease because we had a team of people that really understood the kind of journeys that we were on. It wasn't about spinal muscular atrophy. It wasn't about a child with cancer. It was really about any child with a medically fragile, life-limiting condition, whether they had that diagnosis or not diagnosis. And there are thousands of rare diseases out there. But we recognize that the families just need that level of support, of care in a trusting, comfortable environment, so that they eventually can leave their child under the care team so that mom and dad can go home and get a break. To kind of give you a quick perspective on how a Ryan House would work is that if your family would qualify to stay at a place like a Ryan House or a Helen House, the minimum stay at Ryan House is 48 hours. It's not a babysitting service, and it's not a long-term facility. A child doesn't live at Ryan House. This is really for short-term overnight breaks, but you can't just drop your child off at Ryan House to go to dinner or go to a movie or go run errands. Those are very important, and oftentimes there are some other supportive groups in the community that can help provide that kind of care. But if you want to entrust your child to a team that really knows how to care for a child and their care needs in a safe place for overnight respite, that's very difficult to find in your community. In fact, just rarely doesn't exist. So the minimum stay at Ryan House is 48 hours. It always includes an overnight. A family can have up to 7 days in a row. If you need an eighth day, fine. We always bend and break rules. And then the family can have up to 28 days a year to stay in a place like this, or their child. Every time the child stays at a place like a Ryan House, the parents and the family members are welcome to stay in one of the family suites, or they're welcome to have us care for their child so that they can go home and go to sleep. And that's how you rekindle marriages. You keep connected. You can spend time with your other siblings, brothers and sisters. And that's really what this environment is about. We want to connect with families the moment they find out they're on this journey, whether they have a diagnosis or not, to really help support that family along these very difficult journeys. And we provide overnight respite and what's called palliative care support. So that's the emotional, psychosocial, other challenges along these journeys. So there's an idea about anticipatory grief. How do you find joy and love and enhance quality of life, knowing that your child may not live a long time? Well, our team has child life specialists, social workers, chaplains. We know how these journeys kind of go and help support that family and sibling supports throughout those journeys. Then, if and when the child does need end-of-life care, that's when these become that natural children's hospice home. So, for example, Ryan House, when my wife and I came back from London 20 years ago, there were none of these kind of programs in the United States. England has 54 of these kinds of homes across the United Kingdom. That's a country a fifth the size of the United States. If you just extrapolated to that kind of care access, we would have over 266 of these homes already in the United States to have that same level of care access. But today we have less than 7. When my wife and I moved back here 20 years ago, that number was 0. There were none of these kind of programs. My wife and I started passionately talking about our experiences. The Phoenix community started to rally around us. And one day we decided, hey, I think we're going to do this. And we basically, through the help of many community leaders here in the Phoenix market, incorporated and ultimately built Ryan House. So Ryan House was opened in 2010. It's now celebrating its 15th year, and it has been serving thousands of families in the Arizona community with overnight respite, palliative care support. We've had over 510 children die at Ryan House as that end of life care over those 15 years, including my son who died there in December of 2018. When you think about globally how this model of care is kind of expanding, as I mentioned, the very first one in the world was 1982 called Helen House, a very simple model created by a woman named Sister Francis to help Helen, who was a young girl, very complex. She just recognized that those parents needed a break. And that was the idea of how the first one of these kinds of homes was created. And then today there are 54 of those. The model has expanded. It took 13 years to bring the first one to North America. That's in Vancouver, called Canuck Place. Today, Canada, our neighbors to the north, have 7 of these homes. And the United States, it took another 9 years before the first one of these homes opened in the United States. That was in 2004, the year that we incorporated Ryan House. It took us 6 more years to get the second one open, which is Ryan House. And then since there's a third one in Indiana, there's another one in Crescent Cove in the Minneapolis Twin Cities areas, and a few other ones scattered around. And what we recognize is that there are these umbrella national organizations that are helping to kind of steward this momentum. In England, they have an organization called Together for Short Lives. In Canada, the Canadian Network of Palliative Care Homes. And so what we recognize is that we needed a national umbrella organization to really kind of help pull these growing grassroots groups together to share best practices, to help encourage each other, and to say, hey, look, you can do this in your community. And that's why in September of 2022, we created the National Center for Pediatric Palliative Care Homes. Why are there so few homes in the United States? It really comes down to children are not little adults, but yet what we're trying to do is basically build programs that are designed for children, and we're having to work within a regulation system and a set of policies and reimbursement pathways that are designed really for adult care, which is by far the lion's share of healthcare in the United States. So what we recognize is that for us to get more of these programs going in the United States, we need to basically reframe the conversation and really create licensing really designed for these kinds of programs, and connect those to funding mechanisms, which really is the Medicaid system, which has a lot of political challenges right now. But that's really the primary source of funding opportunity for these kinds of programs, as well as primary insurance. And so those are the things that we're now starting to address at our national level. There are lots of pioneers out in America that would love to try and help champion having one of these programs in your community, like my wife and I did 20 years ago. So we know there's a demand, and it's about how do you help support these people that want to kind of create these homes. So what we've done is, as I said, we've created the National Center for Pediatric Palliative Care Homes. That organization has basically 3 pillars of activities. One is education and awareness. We're really trying to shed a light on these our family needs, as well as these kinds of care models in communities. So this isn't a replacement for the hospital. If your child is sick, don't bring them to one of these homes. Go to the hospital. That's where the medical care is and the specialists are. What we're doing is really an extension of home care, but everything can't be done in the home. There's a nursing shortage in America. So how do you create these more community-based children's respite and palliative care homes? So education and awareness is a big part of what we're trying to achieve. The other thing is advocacy. This has changed the world stuff. We really need to start having conversations with policymakers at the federal level and at the state levels to really start to reframe how we think about children's healthcare. And then our third pillar is community building. How do we really make sure that these pioneers and programs across the U.S. Are supported and encouraged to get one of these open in all the different markets? So in California, for example, George Mark Children's House, the first house is in the Bay Area. They were the first. They're up and operational. But we've got groups in Los Angeles and in San Diego and all across America. So you can see this map here on the right. 20 years ago, when my wife and I came back from London, this map was 0. There was not a single one of these programs operational in the United States. Today, we have 40 communities across 27 states and growing fast. What you can see on this map is that there are 3 different color dots. There's green existing homes, yellow emerging homes, and blue conversations beginning. The 7 existing homes here in Arizona down here is Ryan House, George Mark, Minnesota's got one, Chicago, Indiana, Seattle, Washington, and now one just recently opened up in Utah. And then you've got all these yellow groups. These are groups that are already organized. They're already incorporated. They're trying to raise money to put a shovel in the ground and actually build one of these. Those are the kind of pioneers and champions that we're supporting at the national level, how to help them get open. And then since we started our organization just 2.5 years ago, the word is already getting out. People are hearing about us and hearing how we can support them. And they're coming to us and they're saying, we want one of these in our community. So if we've got Hawaii, for example, is a group that I spend a lot of time with. There's a nurse in Hawaii that said, look, I care for these families along these journeys. I know how difficult this is. We need one of these programs to serve the Hawaiian Islands. And so what we do is everybody on this map understands these journeys. We get it. What the challenges of these dots are is that they come to us and they say, how the heck do we start an organization? And that's really the business side of all of this. So they're asking me and my team to say, how do you start an organization? That's about articles of incorporation and bylaws and filing your papers with the Secretary of State or the Corporation Commission in your state. And we help with that. We've got templates to help that process happen. Then they're like, how do we become a nonprofit to raise more money? So that's about applying to the IRS to become a nonprofit. And that's a very complicated form. But again, we've done that a number of times. So we can help these pioneers learn much more quickly how to do that. We don't charge fees for anything that we do. Again, I'm very driven to have hundreds of these houses in America. And so we're raising our own money to help this network happen so that we can help get hundreds of these houses in America. So again, as I said, we were trying to reframe the solution. Our vision, as I mentioned, licensing is one of the biggest things that we have to tackle in America to create a much easier pathway for these homes to emerge. Today, it's about duct tape and Band-Aids. So Ryan House here in Phoenix, we had to license Ryan House as a hospice organization, which is helpful in some ways, but it also creates regulatory barriers in other ways. It's difficult to provide respite services under a hospice license if the child is not designated as a hospice child. And not all the children are ready and families are ready to have their child be hospice, so to speak. In other parts of the country, we have derivatives of skilled nursing facilities, and those may seem appropriate, but there's a lot of regulatory rules around skilled nursing facilities, and they kind of become over bureaucratic for the kind of work that we're trying to do. So in our world, what we wish happened was we wish there was a pediatric palliative care center license. This is kind of our vision of what we wish was in America. So our group is now working with the Centers of Medicare and Medicaid and federal legislators, so senators and congresspeople, to get definitions of this kind of a center license into the laws so that the states can then pull from that and we can have consistency across the country instead of all these different iterations and variations. Our dream is to have a license like this that really allows us to create a community-based program for children and youth with chronic, complex, and life-limiting illnesses, which I would say all of your families fall into that bucket, that are contributing to shortened life expectancies and their families. This is a holistic support. So we want to be able to provide sibling support and family-centered care and respite and bereavement and end of life and care coordination and pain and symptom. All the things would be under a nice, clean license. So to help us do that, our organization has a government affairs council and a national advisory council with just some very passionate expert leaders. And what we've done is issued our national policy agenda, and we've now taken it to the next level where we have a Dear Policymaker letter, because we're really at the cusp now of starting to set up those meetings with leadership at Medicaid back in DC and with federal congresspeople and senators to help us start to get bill language put into the US laws. And one of the things that I'm really proud of is that our little center, which only started 2.5 years ago, is getting the attention of other very large groups that also support our families, all of your people. So some of the people that Caroline just mentioned, for example, Jill Kagan at Arch National Respite, she has signed on to our Dear Policymaker letter. I connect a lot with Jill Kagan. In fact, 2 weeks from now, I've been asked to be the keynote speaker at the Arch National Respite Conference in Huntsville, Alabama. So I spend a lot of time with Jill. She has put her name and her organization on our policy letter We also have gone after all the disease organizations. So Batten's disease and National Tay-Sachs disease and Rett syndrome and United Leukodystrophy. I'm having a conversation with the Muscular Dystrophy Association for Duchenne's muscular dystrophy this next week. My son had Cure SMA or had spinal muscular atrophy. So we will soon be adding the SMA organization and hopefully the Muscular Dystrophy Association to this letter as well. Hopefully some of you have heard about Courageous Parents Network, which is another area of support, Family Voices, the National Organization of Rare Diseases. All of these groups have said we care about our families and want to lend their credibility and their, extra emphasis to this dear policymaker so that our voice is much louder now. And so I'm really thrilled about that. And it's working. So I'm really excited to say that in Iowa right now, we have one of those yellow dot emerging houses that is that I spend a lot of time with. Shanna, who is her son Mason died of cancer and other complications a few years ago, is really passionate to create Mason's Lighthouse in Iowa City, Iowa. She's been able to connect with legislators at Iowa who've been very receptive to want to bring this pediatric palliative care center license to Iowa. So they've asked us to actually start drafting up bill language to turn that circle into an actual bill and legislation. And so we've been doing that. That bill has now been introduced as Mason's Law. It is just passed the Health and Human Services Committee of the House of Iowa. And on Monday, it's going to go to the floor for a vote. We think it will pass. Then it goes to the Senate, and the governor has already signaled that she is very eager to sign this bill once it gets to her desk. So momentum is happening. The world is starting to change, and I'm super excited about that. As I said, the kind of support that we do, I'm not here to teach anybody about the journey, because the people that I work with and I get a chance to kind of interact with across the country, they already get it. The people that we're trying to help build these communities, what they need is the business side. They need to have help with how do you incorporate, how do you form boards, how do you raise money, how do you, think about a capital campaign for a building. Those are the kinds of things that our organization really provides. Our organization has a lot of experience and expertise and passion, really designed to help kind of scale these models across the U.S. And so I'm just really thrilled that this is really, I say that we're a new organization with a long history. I've been around this kind of work for 20 plus years. The first house, George Mark Children's House in California, I actually toured George Mark when the carpet was being laid. So I've been around, I'm getting old. I've been around this stuff for a long time. So anyway, I just, I could talk about this stuff all day. Really wanted to just share that these models are happening to really support your families in your communities. If you know somebody in a community that really wants to take on a huge project like this and help support other families, we would love to hear from you. We'd love to just be part of the network. We're doing this for you guys, because I'm one of you. And so we're just really, really proud to be doing the work that we're doing, and really hope that our work can hope that our work can help make your lives a lot easier. So thank you very much for the time this morning.